Today, every day, small cap investors visit Agoracom knowing this is the day to discover the world's next great company, to have their dreams come true. That's why I take to the open road, to find them, to tell their stories, to engage them, to bring them to life, because they want to connect with you from your office, your phone, your home, anywhere. Agoracom, find your dream.
Welcome to Beyond the Press Release, a production of Agoracom in which we take the time to speak with small cap executives right after they put out important news. With us again, he's back, Steve McCauley, CEO of Empower Clinics, trades on the CSC under the stock symbol CBDT. Fantastic stock symbol, easy to remember. For our friends in Germany, on Frankfurt under 8EC, and for our friends in the US, EPWCF on the OTCQB. For those of you who are new to the story, here's a quick summary. The company is a vertically integrated CBD life sciences company. So what does that mean? They're a multi-state operator of medical health and wellness clinics. More than just lip service, their patient database, over 165,000 patients. Their patient visitor growth is unbelievable. In Q4, their visits were up 351%. In February, up 800%. In March, up 593%. And for the entire first quarter, up 478%. And that's translating into significant revenue growth. So here to talk about that is Steve. Welcome back, my friend.
George, thank you very much. Always a pleasure to be here.
Well, we're always happy to have you back, not just because you're a nice guy, but you're just, you're reporting great results on stuff. So how can we not have you back? Those are monster numbers that I just read off.
Yeah.
And it wasn't like you were starting from zero or something, and now you've got 30 people coming in. You've got multiple thousands of people coming in. So let me ask you a question. And we kind of covered this last time, but there are a lot of people still discovering you. Retail is suffering everywhere. We know that.
Yeah.
It's unimaginable what's happened. And yet in this period, Empower is booming on the retail side. Why?
Well, we are health and wellness clinics. We operate in Arizona State, Oregon State right now. We've signed our first franchise sale that's going to launch in Oklahoma, and we have a really nice pipeline building of additional franchises coming. But with the current coronavirus world that we're all living under, in the United States and in the states that we operate, our clinics have been deemed essential services. So what we're finding is that, one, we have not had to lay off even one person. We are slammed, quite frankly. The patients are just simply not canceling. And what it's really coming down to is that patients really believe in their plant-based medicine treatment options. And in medical states like Arizona, where we have a concentration of clinics, people, if their certification is about to expire and they let it expire, they cannot go and buy product. So
the last thing they want to do is go back in the traditional medical system right now, of all places. You don't want to be going back to hospitals and walk-in clinics for traditional medicine if you can avoid it, right?
No, and then you've got, and this is more than just kind of a lifestyle to people. This literally is how they deal with their anxiety, their stress, their chronic pain. Perhaps they're a veteran or first responder who has PTSD and is suffering from a myriad of issues. And this is their preferred method of dealing with it on a day-to-day, week-to-week, month-to-month basis. So to have that all of a sudden removed because of the coronavirus pandemic is the reason why we are deemed an essential service. And so our patients are coming in. They are making sure that they have access to our doctors to get their certification renewed so they can continue on managing their life in the best way possible using their plant-based medicine.
So naturally, Steve, it's got to be an inference or direct inference that revenues are being impacted. And I know we can't talk about specifics, but what are you seeing in terms of general trends? Because there are two kinds of customers. As you're talking, your current customers, they have to have their product. There's just no other way. Are you seeing their average purchase, they're increasing by a chance? And then new customers, I'm assuming you must be having new customers coming in because you touched on the fact that stress, anxiety, it's across the entire spectrum now. Before it was just, a percentage of the population, which is a pretty big one, but I don't think there are very many people who are outside of that anymore. And so I'd like you to address maybe what you're seeing from new customers. Are they just kind of dipping their toe, or are they going all out? But let's talk about your current customers first.
Sure. So just to sort of address the question over revenues, I mean, one of the things with our business is there's a direct correlation to a patient visit and revenue. We don't have any accounts receivable. We don't do medical billing.
Right.
So when a patient comes in for their consultation, for the variety of services or additional tests that they may purchase from us, we are getting paid on the spot for that visit. So when we have record numbers of patients coming in, it's a direct indicator or a KPI that says our revenue will correspond in the same records, right? So that's one thing that's why I'm always keen each month to report out what does our patient flow look like, because everybody can directly understand in the investment community that is directly correlates to our revenue stream. The patient mix is definitely evolving. So we have an awful lot of repeat customers. They're very loyal, our patients, but we're definitely seeing new patients come in. And as we get into some new launches in telemedicine, which we're going to talk about, we expect to see, a lot more traffic from new patients in new locations outside of our current clinic reach already. To answer your question on product, we are seeing an uptick in product purchases. We're seeing an uptick in our online product purchases. We're seeing our immune boosting product SKUs actually rise in purchases. People are recognizing that creating immune boosting defense mechanisms within our system is a good practice today in this coronavirus world that we're in. So by having those SKUs available, so we have approximately 25 CBD-based product SKUs, but we also have another sort of 25 high-quality health and wellness products that are complementary supplements to our CBD product line as well. So we're seeing a bit of a mix change as well, where people really appreciate having high quality vitamin C products, high quality mushroom based products available, and so we're just seeing generally a bit of an uplift in that product purchase. And
how is that happening? Is George the customer educating himself because he's going onto your website? Is it because your physicians that are in the clinic are obviously they're great at their jobs, or is there also a combination of you're communicating with your database via email or phone and texting? Hey, George, in case you didn't know, we have these immunotherapies and these immune boosters. Sorry.
Yeah.
In case you didn't know, we have this really high dose vitamin C. How are you guys getting to the customer to let them know that they have this available to them? Because it's like you said, it's not traditional.
Yeah. So I mean,
it's for 20 years.
Yeah, it's really all of those methods. So I'll start with our physicians. So part of the physician's consultation while they're going through the certification, or if someone comes in for a specific immune boosting consultation or a general health and wellness consultation, it's at that point in time that the physician is going to start to recommend different types of treatment options, different types of product options, different lifestyle options that can all contribute to better health. We also have a very strong technology platform for campaigning. It starts with our text message campaign, our platform, our email blast platform, and then our call center. And so when we have products or programs that we're either introducing, reintroducing, we send out thousands of outbound campaigns. We A/B test on the campaigns to find out which ones have the best response rates, open rates. And that's a really important method for us to communicate to our 165,000 patients. And then finally, it's word of mouth, just traffic coming, naturally through SEO to our website, people educating themselves on sunvalleyhealth.com and looking at product. And then ultimately, you can purchase your product right from our store, and we can ship it to you anywhere in the United States. We don't have any restrictions that way.
And the amazing thing about your business model is that you have product that people really want. Like they really have to have it now. So I've got to assume, so you've got two things happening. One, George, the customer, is really willing to, get this information pushed to him. But also from a marketer's point of view, and you may not have hard data, but are you seeing anything towards rising open rates? Because everyone's at home, right? They're not busy running their daughter the soccer game or going to the PTA meeting and getting back and forth from work. At home. Everyone is glued to their devices. Are you seeing any trend? That's me more the marketer. I don't know if you have the data, but I'm assuming open rates must be skyrocketing.
Yeah, so I don't have data to say, hey, we did programs, pre-coronavirus. We're doing programs now, and we're seeing this, correlation there. It's something that we'll definitely start to take a look at as we again start to announce some of these new programs around digital health or telemedicine is another kind of coined phrase for that. We'll campaign to support our new programs, our new launches, our new services, our expanded hours, our expanded doctor base. And it's from there that we dive back into that data. So I think as we talk again in the next few weeks about progress, let's revisit this, and then let me come back to you with some metrics around what we're seeing.
Yeah, and the fact that you're tracking all this stuff is, to you, might be second nature, but I just love the fact that you guys are tracking and you're on top of this.
Yeah, we do. We look at all of that data on every campaign, because we have to know, is our campaign effective, marginally effective, or is it poor? And this is why we have to watch the data, follow the data, and it's why we A/B test. We'll run the same campaign, two different versions of the message or different color palettes to two different groups. And we look at, these open rates and conversion rates and click-through rates to understand, hey, did this program A perform better than program B, or vice versa? Well, you follow the data. That's the way you get better at campaign marketing.
Steve, you make me want to be a better marketer. Before I hop on telemedicine, the last thing I want to talk about with the real world is, people are, on the one hand, your customers, as you definitely emphasize here, they need their products. But on the other hand, they're terrified to go out. They're scared about where they're going. So the fact that your traffic is so strong, is that an indication of excellent safety protocols, and your customers are recognizing that you've implemented insanely great safety protocols at the clinics?
It really is a reflection of that. I think if we did not really quickly adjust our operational protocols, I believe that we would see a decrease in traffic, because there's so much trepidation out there and anxiety that at a point in time comes, if someone comes up to our clinics and all of a sudden there's 25 people in a waiting room and, it doesn't seem like it's been sanitized, people are going to walk out and they won't return. So we overhauled. Started with deep cleaning of all of our facilities. It included simple things such as signage, just communicating right at the check-in desk. Here are all the steps that the CDC are recommending. Here are all the OSHA requirements that are being recommended. So we've done all of these things. We are asking you to actually fill in your paperwork in your car in the parking lot by yourself. And when your appointment is exactly ready, we phone you and we text you, and you come in on your own. We've limited the number of people allowed in our facility to less than 10, including staff, at one time. We take the temperature of our staff members when they come in for their shift, and we also, a second time during the day, take their temperatures as just a precaution. As a protocol, we have the electronic, digital thermometers in all of our clinics, so we can quickly zap someone without even making contact and understand if they have a temperature or not. Again, it's safety for staff, but it's also safety protocols that we can demonstrate to our patients. We put signage on all the doors, asking people to kind of self-identify if they feel ill. If they know they've come in contact with someone who is showing signs of coronavirus symptoms, please respectfully do not come into our clinic. we'll find a different way to connect with you. And this, is coming up, now with our big telemedicine push is exactly the type of technology to utilize for those, specific situations and others. So I think, it's amazing what the team have done. I mean, operationally, how they've adjusted, it's amazing. And
starts from the top, though. Starts from the top, and I'm sure you led that, right? You're a Six Sigma certified, CEO, and I'm sure that came from the top as well. Great team. Your whole team is awesome.
It's the team. It's the team on the ground. It's Andrea Klein and her operational team on the ground that are making this happen. And it's every day. Like, this isn't sort of, you implement something and you walk away from it. I mean, we talk every day. I'm on the phone with my operational teams every day. Just an update. How are things going in the clinics? How are our staff doing today? Has anybody shown signs of problems, or is there a need somehow? And what we are doing each day is we're adjusting and we're accommodating. We're getting people to work from home if that's possible for them. We're adjusting where people work or what time their shift works, because every day is so fluid right now in the dynamic environment that we're in. So we have to be operationally precise each day and be prepared to adjust and change and evolve as it comes our way. But we're doing.
And I have to admit that hearing you say that, I can almost feel the relief a customer of yours, a patient of yours must feel as they're walking up to the clinic, probably the first time, having the trepidation, seeing all that in place, and just decreasing their anxiety right there, just on that, saying, okay, I can get my help, and it's not gonna hurt me being here to get my medication. So hats off to your team for it.
Absolutely. And we, there's advanced communication as they're booking their appointment. We communicate by text message, with our call center. So we're setting expectations with our patients before they even come to their appointment. And then, to your point, once they arrive and they see that our protocols are in place, it gives them more comfort to go ahead and continue with their appointment, see the physician, get access to their plant-based medicine, and our essential service, our health and wellness facilities, operate in this challenging time.
A lot of ways that itself might turn out to be a marketing tool for you, because think about it. George goes to one of the wellness clinics, comes back home, talk to people on the phone and saying, hey, George, how you doing? Well, I went to a wellness clinic today. Hey, George, are you crazy? You shouldn't be going anywhere. No. You should see this place. First of all, I need the product. Second of all, you should see the protocols. It's the cleanest thing I've ever seen. And that turns into its own, pardon the pun, but its own viral message at the end of the day. So
yeah, I
good
think
on you guys for doing that. That's for sure.
Yeah, I don't think that we haven't approached it with that in mind. I mean, that
of course not. No, I didn't mean to imply that either. But it's just naturally people are going to brag about it, right?
Well, I think there should be some of that. I mean, we're all people at the end of the day, so we have a collective responsibility for each other's health and safety right now. And we have a responsibility to do everything within our power to make our environment as sanitary as possible. I mean, one small step that we do is the check-in area and the consultation area. After every patient visit, it gets wiped down and sanitized before the next patient comes in.
Man,
it's just a new protocol that needed to be added. It's just that extra safety net that we can control in our procedures. So we take that step.
Last question for you. Not everyone can make it into a clinic. Not everyone is even within driving distance of your clinic. So you announced this press release. I'm a telemedicine initiative as well, giving access to physicians across multiple states.
Yes.
Can you, that's kind of new. It's something you touched on in your last interview, where you had heard about telemedicine happening in Florida, and you're pretty confident it was gonna, make its way over to you. And here it is, it's happened. Can you give everyone at home just a basic understanding of how does that work? So here's George, potential patient, but I'm not within driving distance, or for whatever reason, I can't get to one of your clinics. How does the telemedicine initiative work?
Sure. So we've been involved with telemedicine, in my tenure with the company. Telemedicine has is the regulations behind telemedicine and this concept of digital health are rapidly evolving, especially with coronavirus, where the states are recognizing that if we were restrictive previously, we better get progressive now, because to your point, some people either can't make it in, won't want to go and see someone physically face to face, but they certainly need access to the physician, access to the nurse practitioner, access to our administrative team. And they can do it remotely using a HIPAA compliant technology platform. So we have gone ahead and upgraded our platform. We are going to be announcing, early next week, it'll be fully live. We're doing our own internal test pilots right now on the tech itself, but it's going to be, really loaded up this weekend. We are adding additional physicians to our platform. So these are physicians who aren't even in our clinics, right? We're adding additional support staff to deal with the volume. So in a crisis time right now, where so many people have lost their jobs temporarily and permanently, we actually are hiring and adding more staff. And so we're grateful to be able to do that. And we haven't laid off anybody to date since the coronavirus situation has become so serious. So how this impacts us in multiple states. So if you take the state of Arizona, our physicians, everybody's completely booked in their appointments, the physical appointments during the day. But we have the ability to open up earlier for telemedicine appointments. So a doctor, today we open at 10 o'clock at a clinic. We can have them come in, and they don't even have to come in, frankly. They could be at home at their home office and actually start consultations through telemedicine, because we make those online appointments available. So covering the entire state of Arizona is easy for us. But we've also got physicians in Nevada, as one example, a doctor there who's going to start up with us again, who is duly licensed and certified for not only Nevada, but also California. So it will allow us to instantly start serving patients remotely in Nevada and remotely in California. And again, we just open up the online portal. That good physician stays at his home office in the state of Nevada, but serves patients through the Sun Valley Health, and what I'll start coining as Sun Valley Digital Health, and utilize our telemedicine platform for not only our current core competencies, but we're going to launch an immune boosting consultation, because we believe that the need for consumer education on what I can do to boost my immune system in this high-risk environment that we live in. There are strategies and protocols that patients can adopt, but you just want to be able to get that correct information from the specialist, the physician, the naturopath, the nurse practitioner who can
stop guessing on Facebook, stop guessing on Twitter, stop guessing when your friend sends you some email about get it straight from a physician at the end of the day, someone you know is licensed and knows what they're talking about.
Yeah. So
that's powerful, Steve. That's powerful. And how does that work from a revenue point of view? Am I, no matter what, obviously if I order product, that's a given. We know how that works. But am I paying for that consultation? Is it a free consultation? Is it, so is it a revenue center right off the bat?
Yeah, it's a revenue center right off the bat. So there's basically a menu of available, online services that our physicians will be able to provide. So we'll publish what those are. And so no matter what the consultation is, there's going to be a fee associated with it. So this will be a situation now where not only do we collect the revenue directly through our telemedicine platform, but the other thing that takes place is some of these services now will cross over to medical billing, because in the current state of emergency, these type of telemedicine services are the healthcare system in the U.S. is now required to support and pay for those consultations.
Oh yeah, you can bet on that.
Yeah, so we expect that this is all accretive revenue to us. This is not replacing one for the other. This is seeing new patients in a new manner. We'll go out, of course, to our existing database, because it may not be time for your medical cannabis certification, but you may want to talk to us about immune boosting and other complementary health and wellness protocols in this most critical time.
Steve, I got to tell you, hats off to you. You keep just impressing. The job you do is just impressive, and it keeps getting more and more impressive as time goes on. And the numbers speak for themselves. Right? At the end of the day, your job is, you're the CEO of the company. You've got to be optimistic, and let's face it, you've got to put your best foot forward. But the numbers, Q4 patient visits up 350%, February up 800, March up 593, Q1 in total up 478%. Great job to you and your team.
Thank
and
you.
Given the fact that more information will be coming out about telemedicine, I'm sure we're going to have you back on again. But thanks for joining us today. Not only for shareholders to get a fantastic update, but for Americans who may be watching this and may suddenly say, okay, Empower is a source for me. I've got to get onto this telemedicine platform. So for everyone at home, if you're watching, you're American, wait for the company's press release next week. I'm sure, right, Steve, that'll have some detail in there about how you access it.
Absolutely. We'll have a lot more detail about, what the platform is, where it's going to be made available and offered, what services and or products a patient can access. And again, it doesn't have to be an existing Sun Valley or Empower Clinics patient. It's open to any consumer, in the United States, in the states that we can legally operate, where our physician base are located. And we'll also talk about how we will be expanding to other states, because our platform is agnostic to location. It's available anywhere in the United States or anywhere around the world. We just have to comply with the state medical boards and make sure we're HIPAA compliant in the way that we operate. But we'll see a lot of effort and expansion into our reach so that we can have more doctors on the platform, more admin and support people behind the scenes, so that we can serve more patients in the United States quickly.
Steve, thanks so much.
Thank you, George.
Really love having you on.
It's my pleasure. I appreciate the forum here. It's great for us to talk about this in detail.
Yeah, absolutely. Because there's only so far a press release can go, right? And everyone's got time in their hands now. They've got time to watch either via video or listen via podcast. So yeah, thanks, and looking forward to having you back again soon.
Thank you, George.
You've been watching or listening to Steve McCauley. He's CEO of Empower Clinics. The company trades on the CSE under the stock symbol CBDT. Again, fantastic stock symbol. For our friends in Europe, on Frankfurt under 8EC, and for our friends in the US on the OTCQB under the stock symbol EPWCF. Start your due diligence. You've got a lot of time in your hands. There's a lot of change and paradigm shifts going on in the markets. You can see that Empower is actually part of the next generation of companies. So start your due diligence, get to Agoracom, read the profile information, watch other interviews we've done with Steve, because all of those are informative, powerful, and most importantly, Steve has followed through on pretty much everything he's had to say in those interviews. And then head over to the company's website to complete your due diligence, and hopefully you've discovered your next great small cap stock. Have a great day, everyone. Please be safe. Please follow the rules. Stay home unless it's absolutely necessary, and let's all get through this together. Until next time, have a great day.